system.
Okay. Okay, I'm ready, ma'am.
Okay, so if you've read and understood, considering it clinical examination station, please begin.
Okay, knocking the door, greeting the examiner. Hello, good morning. This is my candidate number 760.
Yes.
Going to the patient, washing my hand. Hello, good morning. I am Dr. Abdul Qadir, one of the surgical doctor here today. May I confirm your name and age, please? Okay, nice to meet you, Mr. X. Today I'm going to examine your chest. This involves me looking, feeling, and listening to your chest. Is that okay with you? Yes, to perform examination, it is needed to expose your chest anatomy at some point of examination. Would that be okay? Yes? Okay. Would you like any chaperone to be with us? No, I don't want anyone. Okay. Before we start, do you have any pain or shortness of breath? Oh, Mr. X, I can see you are very distressed. This might be related to your previous surgery. So I am going to stop my chest examination and start supporting you vitally, including airway, breathing, and circulation. And I may give you fluid. Is that okay with you? Okay, I need assistance, please.
Yes,
Okay,
available.
okay.
How can I
Uh,
help you?
yes. Can I know your name, please?
Yes, I'm Tim Western.
Okay. Nice to meet you. Okay. Could you please open your mouth, Mr. X? Okay. Uh, Stick up your tongue. Okay. I'm going to give you, since you are talking with me, Mr. X, this means your airway is patent. So I am going to give you oxygen and put this device in your hand, which calculates the amount of oxygen in your blood. So please, I want you to give this patient 50 liter of oxygen by non-rebreather mask, and please put a pulse oximeter in his hand. Okay, Mr. X, now I'm going to measure how fast you breathe. I would like to measure his respiratory rate. Now I am observing. Then I am moving to the trachea. Okay, Mr. X, now I am going to feel your windpipe. This may be slightly uncomfortable, but please bear with me. Okay, feeling his trachea. Now, Mr. X, I'm going to place my hand tightly in your chest and ask you to take a breath in and out every time. Mm-hmm, mm-hmm, mm-hmm. Okay, Mr. X, now I'm going to tap gently in your chest. This may be slightly uncomfortable, but please bear with me. Percussion, 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 percussion. Okay, Mr. X, this is device called stethoscope. I am going to use it to listen to your chest. It is not harmful at all. And I want you to take a breath in and out every time I place my device. Mm-hmm, mm-hmm, mm-hmm. Okay, now I'm going to listen to your heart sound while I am putting my hand in my neck, my hand in your neck. Okay, okay, palpating the mitral area, tricuspid area, pulmonary, aortic. Okay, Mr. X, could you please sit upright for me if you are able to? Okay, are you able to? Yes. Okay, I'm going to do the same thing. I'm going to take a look from the back. Could you please place your hand like this? Okay, taking a look. Okay, and now I'm going to place my hand tightly in your chest and ask you to take a breath in and out, taking chest expansion from the back, then doing the percussion. Okay, now I'm going to tap gently. Please bear with me. Okay. This is okay. Now I'm going to listen to your chest using this device called a stethoscope. Please take a breath in and out every time I place my device. Okay, he's taking breath. Mm-hmm, mm-hmm, mm-hmm. Okay, now I'm going to press tightly in your back. Is that okay? Checking the sacral edema. Okay, Mr. X. Now you may lay down, checking the circulation. Starting with the capillary refill, I will request to check the pulse rate and blood pressure. If he allow me, I will do it. If he said skip, I will skip it. Then looking for GVB. Could you please turn your head to the other side, please? Look into his neck. Then please, do you have any pain in your eyes? Okay. I'm going to bring your lower eyelid down. I want you to look up. Okay, thank you. Okay, now, Mr. X, I'm going to place two elastic tubes through your veins and drop some investigation. Is that okay with you? Yes, it is okay. Yes, please insert two white bar cannulae to Mr. X and do full blood count, urea and electrolyte rival function test, and full blood count and blood cross matching and blood grouping. Okay, Mr. X, now I'm going to insert elastic tubes through your down there to count the amount of your urine. Is that okay? Okay. Please, could you please insert a full catheter to this patient and please monitor his urine output? Now, Mr. X, are you with me? Are you okay, Mr. X? Are you feeling better? Okay. Now I am going to ask you some question. Do you know where we are exactly now? Okay. Do you know who am I? Do you know what time of day is it? Okay, I am going to examine. I am going to take a look to your eye using this light of source, and this may be slightly uncomfortable, but bear with me. Taking his pupil, and then I will move to disability. Okay, now I'm going to take a look to your wound. Is that okay? Okay, I'm going to listen to your bowel sound. Okay, listening to his bowel sound. Okay, now I need to take a look at your lower leg. Could you please lift your gown or trouser? Okay. No, no, don't worry. I can help you. Taking a look at the lower limb, but don't touch it.
Okay,
Do you
can you
have any
please
veins there?
summarize your examination now?
Okay. Today I support this gentleman vitally and including airway breathing and circulation. I would like to complete my breathing assessment by reviewing the chest X-ray and circulation assessment by reviewing the ECG and reviewing the operation sheet and the vital sheet. And I would like also to review the fluid chart and the investigation and the imaging for this patient.
Okay, so what was your finding?
The patient would have low oxygen saturation and in percussion in chest examination he have reduced breathing no breathing sound, decreased breathing sound on the right side, and in the circulation, his pulse be probably in the chart. So uh, I can't get a finding increase. Sorry, ma'am. So it depends on the case. I can't imagine the presentation exactly.
Okay, so all right. How would you? Okay, examination. C patient was operated for right hip replacement 8 days ago. So what would be your differential diagnosis?
Okay.
Why could a patient present with a chest pain?
Okay. According to the history of previous surgery and the fact that the patient have a chest pain and gasping on oxygen,
Yes,
I would suspect pulmonary embolism.
yes,
I should also suspect chest infection like pneumonia, or it
yes,
could be due to heart failure due to volume overload, or it
yes.
could be due to injury or bleeding associated with surgery, or it could be due to other respiratory distress syndrome or basal atelectasis,
Okay,
or in the fact that the patient had a pain or may affect his breathing. But
yes. So how do you think patient should be managed?
okay, patient should be managed after the assessment according to CRISP, airway, breathing, and circulation. He should go for investigate for ABG and review his ABG if he has already ABG. If he has not, I will request ABG chest X-ray and I would request electrolyte and apply the Wells criteria. If he is suspectable for pulmonary embolism, I will go for CTBA. If it is non-massive and the patient is stable, I will go with low molecular weight heparin according to trust protocol. And if it is not, and the patient is not stable and it is moderate, I will go with low molecular weight heparin or catheter directed lysis and I will go with surgical embolectomy. If it is a
Okay,
massive, I will look if the patient.
If you suspect
Yes.
patient is suffering from pulmonary embolism and you ask for simple ECG, what findings in ECG would confirm your suspicion of pulmonary embolism?
Okay, the patient would have sinus tachycardia. He would have deep S1 in the first lead and deep Q wave in the lead 3, S1, Q3, and T3.
Deep
T-wave
S wave in lead 1 and lead 3 what? Q wave in lead 3 and
T wave in lead 3.
Inverted T wave in lead 3. Yes.
Yes.
All right. And yes.
Yes.
All right. Okay. And there'll be right axis deviation.
Okay, right. Yes.
Okay. And second question, or the last question, if you're scrubbed, right, and you're this patient, all of a sudden nurse comes and tells you that she thinks your patient has pulmonary embolism, what would you do?
Okay, I will stick with my patient and ask one of my senior or colleague to review the patient.
No, you'll call for the crash
Team.
crash call, yes. Because you're busy, you're scrubbed, you can't go, you can't leave your scrubbed patient, like the patient for which you are scrubbed. So you'll call for the crash call. Good.
Okay, what is crash, ma'am?
I'll tell you.
Okay.